This is our great pleasure to be able to present here in ESC Digital Summit, the very first one in the series of ESC. I'm Patrick Tan with my colleague here, Brian Law, who are both computer scientists by profession and by training. Why we come into this cardiology-related research and development is because of our years of collaboration with our cardiologist friends in the local hospitals and clinics in Malaysia in the same region, where we come across a lot of gaps between cardiology practices, diagnosis in relation to the advancement in technology, which predominantly we call it as artificial intelligence and machine learning, where we can see machine learning and artificial intelligence can actually close the gaps that cardiologists potentially face or already face in their daily operation. So for instance, what we are focusing today is stress echocardiogram, where there are massive of data set, especially in digital format, in digital video in this case, has been very prevalent. And the data size and data volumes has been growing significantly because of digital advancement in the instruments, the equipments and facility the hospitals are using. So this digital data growing in size, but the number of cardiologists or radiologists are not growing in the same rates. So the growing number of data uh, uh, overwhelm the growing number of health practitioners. So what we can see immediately is, why not we look at artificial intelligence and machine learning to help the clinicians to better diagnose, in this case, the anomaly in stress echocardiogram. So that can save the time, first of all. Second is to increase the accuracy of the anomaly detection in the normal stress echocardiogram. Third is to help the younger clinical practitioner to learn how to diagnose or how to detect anomaly in stress echocardiogram. So that gives two ways of benefits to the clinical setting. First, to train the new clinician coming into play. Second is to increase the accuracy of diagnosis in stress echocardiogram. So we as a computer scientists come to this summit to share our idea and our solution and our technology that my colleague Dr. Brian and myself have developed to address how this problem can be solved in this digital age.
Basically, when we have artificial intelligence, what we are trying to do is to mimic the human mind. Therefore, by having this an autoencoder, we can compare that to the child of a mind, to the mind of a child, whereby, for example, if we were to teach this child to draw circles all their life, if we were to show them a picture of a circle, they will be able to identify that this circle is a circle. However, if we were to give them, let's say, a square or a triangle, they would not be able to identify this image. Why? Because they have been taught to draw circles, to identify circles their whole life. Basically, we are trying to do the same thing. By teaching this neural network, this autoencoder, to learn what is a normal echocardiogram, by giving it an abnormal echocardiogram, we can teach it to tell the difference between normal and abnormal. Basically, we're trying to classify normal and abnormal echocardiograms. In the real world, there's one main issue whereby we lack data. For example, there are certain rare diseases whereby it is very hard to come across data. So in this case, instead of training our algorithms by collecting lots of different type of data, we can just collect data from normal patients, healthy patients, and then train our algorithms with this healthy data to detect abnormal data. Basically, that is the idea, trying to overcome the issue of lack of data.
the plan that we have in mind is to have an artificial intelligence AI in a box. So when I talk about box, it's literally a physical box that users or hospitals or clinics can use the box as if it is a computer by itself. So this box, let's say the clinicians, they can use this box to run through the stress echocardiogram video files into the box, and the box can give the diagnosis results back to the clinicians. So in this way, we can help the clinician to remove the concern of data privacy. So the clinician don't have to worry whether this data will go to the wrong hands or not, because the box is in front of them physically, first of all. Secondly, where this box is actually a trained neural network. In this case, it's a deep learning model. And this deep learning model will continue to learn when the model look at unfamiliar stress echocardiogram, which they have not seen it during the training stage. When I say they, it means the model, the software itself, not we or not the clinicians. So this model in the box will become smarter and smarter over time. And the clinician who use this box will continue use it with improved accuracy over time. Over time can be over weeks, over months, or over year. So we as a computer scientist, we can curate these improved models over time from the hospitals physically. Okay, let's say after 1 year or 2 years, we can go back to this box to pay a visit to this box, talk to the clinician what they have learned, what they have benefits from using the deep learning model. And from there, we can always make the models improve by curating more and more models over different settings of hospitals or different clinics, or even in different regions, different countries, different continents in future. So this is the plan that we want to move forward to expand and improve the deep learning model in this box by expanding and also deploying the box to more and more clinicians around the world. Not yet. At this stage, we have demonstrated this technology actually working. So moving forward, we will be establishing this AI in a box so that it can be used by more and more clinicians in Malaysia or any part of the world.